I was born in India and in Gujarat. So I did all my schooling. I came from a middle-class family in Ahmedabad and did my medicine over there and came here when I was 30 years old. So migrated to Australia straight from Ahmedabad, India, and came into absolutely a different world altogether. When I came here, they wouldn't recognize my qualifications, so I had to give my exams again. Then I went through and passed all my exams, became a doctor over here, practiced in the hospital, and then started up my own surgery. Started private practice here on my own in Parramatta in 1997. And so it's been about 14 years that I've been a solo general practitioner. I see all sorts of patients, but in the last 3-4 years, there has been a lot of Indian ethnic background patients, and that's because I think I speak the language and they feel comfortable with the female GPs. I came with my husband, and he was the one who actually got a visa over here, so we followed him. My daughter was only 2 years old when we came here. So it's only the three of us still, except that my daughter just recently got married and she's having a baby, so we came as 3 and now we are 5. I speak Gujarati, I speak Hindi. People tend to talk to me in all Indian languages and I sort of know a little bit. It was amazing the way it happened. I generally, after the age of 40, I used to get my breast screening done regularly. We were all preparing for my 50th birthday. We were planning a big function and I had my big birthday party planned. Just about 2 weeks before that, before the actual birthday, I thought I would get my mammogram done. I got a phone call saying, look, come back for this. You know, there's something that we've seen, something that you need to repeat the mammogram. Went there again. They kept me for the whole day at the breast cancer clinic at Westmead. Did a mammogram again, said definitely you've got something there. We need to do a fine needle aspiration biopsy, which we did again, which they did for me. Came back, it was cancer. I burst into tears. There were so many things happening in my life. My parents were coming from India. I had this party planned. I didn't know how to handle the whole thing. But when I told everybody, we went through the whole party as if nothing had happened. Only my friends knew what had happened. I've got photographs of the party. We all looked happy and we had a great time. A week after that, I went for my surgery, and everything. I think the mammogram saved my life. And today, my daughter is pregnant as well, and I can actually look forwards to those sort of things. These women who came to my house, we had a forum, and in the forum, just to see how we can support towards the breast cancer cause. Can you tell me who has had the mammogram done? And it was to my shock and surprise that 50% had not had it. My friends, they're not my patients, but they're my friends. And I was shocked that and then I said, look, the only thing you can do for me is go and get a mammogram done. Make sure that you're okay. They have this feeling that Indian women don't have that much, or I breastfed my child, so nothing will happen. I don't have a family history, so I won't be affected. But I didn't have a family history. I breastfed my child. I didn't have any risk factors. I've got 80, I've got my mother who's 86, and I've got another 3 relatives who are over the age of 80. No one has breast cancer. It was only me. So, and luckily, I was detected at a very early stage, so we could get things done straight away, and the outcome was great. but I hope others are as lucky as me. But they can only be lucky if they do something about themselves. You can be any age. You have to start doing your own self breast check and be aware of your body. People are not getting it done because they don't get letters. They're not getting it done maybe because, of course, I said that, you know, they think it won't happen to them. Maybe it's too difficult. Maybe they feel that it's painful. It's not painful. So it's an easy test to get out of a lot of problems later on. When we were in the breast cancer clinic, my husband came with me the second time just for moral support. And when they told us, yes, it's definitely cancer, I had a big cry on his shoulder, and he said he was also shocked because we didn't expect anything like this. And when we went back for the mammogram, we were told that 10% of all people are called back anyway, you know. So when we realized that, no, this is something real, well, he was there. He said, look, we are in it together. We'll support each other. Don't worry. It's okay. Then we rang up my daughter. She said, I'm coming now. So she left everything. She came straight away to the breast cancer clinic, had a big cry and said, I've already spoken to my boss and I'm taking part-time, you know, I'm just starting part-time. I don't want to go full-time back. I'll look after you. It does affect the whole family. And yeah, and I want to be there for, I mean, I've got one daughter, so I want to be there for her. I mean, I wanted to be there for her wedding, which was a year after, I had my surgery. And now she's pregnant, this is her baby shower. I mean, all I can say is self-breast check is very important. But I'm a doctor, I do breast checks for everybody else. And I didn't find my own cancer. You know, I didn't find my own lump. There was nothing there. Nobody could find it. Even the surgeon couldn't find it. So it was only on mammogram that it was detected. So don't be, I mean, do a self-breast check, but don't be relaxed that nothing, you know, I mean, if I can't find anything, it's okay. If you've got a close relative who's got breast cancer, at an earlier age, you need to start earlier. So that's my message. I think as doctors, we really are in the ideal position to actually talk to our patients and tell them, even take out those little 2 minutes at the end of the consultation to say, look, have you had your mammogram done, or have you done your self-breast check done? Those 2 lines may save somebody's life one day. So I think we should just do that. You know, I mean, we do that already, but maybe we should just be more aware of doing it more often. As a community, we should all come together. There are so many different organizations, even in the Indian community, even in, you know, I'm sure it's in Sri Lankan communities as well. We need to actually get above all our differences and come together for a cause like this and raise the awareness for breast cancer. Those who've never had a mammogram should have one. And of course, if you've had a family history, then you have to see your GP and maybe it starts earlier. Those who've had a mammogram need to get it done every 2 years. Just having one mammogram doesn't mean that, oh, you're covered for life. It's not like that. You have to make sure that, you know, things like this can develop anytime. I'm Dr. Palu Malaowalla, and I'm really happy to be supporting this Pink Sari Project. હું ડૉક્ટર પલ્લુ મલાવાલા છું અને આ પિંક સારી પ્રોજેક્ટ માટે હું સપોર્ટ માટે બહુ ખુશ છું. मेरा नाम डॉक्टर पल्लू मलावाला है और मैं ये पिंक सारी प्रोजेक्ट सपोर्ट करने के लिए बहुत खुश हूँ.